Hello everyone, and welcome
Recording
to
in progress.
today's webinar hosted by the Coalition for Global Hearing Health, Family and Community Empowerment Committee. Today's topic is the power of parent and deaf-led groups, improving outcomes for deaf children. My name is Liz Seidel, and I am the International Head of Policy at Deaf Child Worldwide, which is part of the United Kingdom-based National Deaf Children's Society. Deaf Child Worldwide partners with countries to set up sustainable, universal newborn hearing screening and early intervention programs. And we support children with any level of hearing loss. I co-chair the Family and Community Empowerment Committee alongside Dr. Selvarani Moodley of the University of Witwatersrand in South Africa, who is on the call with us today. I am so excited to introduce our wonderful speakers and hear what they have to say. But first, I do need to cover a few housekeeping items. So we are recording today's webinar, as has been announced at the top of the screen. I do want to introduce our international sign interpreters, Glory and Marzanne, and we also have a captioner, Maria. If you are using the interpreters, you can pin them. And if you need multi-pin, please ask in the chat, and my colleague staff will give you access. If you need English captions, please click CC Show Subtitles. We do ask that you keep your camera off and please keep yourself on mute so that everyone can hear the presenters clearly. Please ask any questions in the chat box. We have dedicated time after everyone has spoken to answer as many questions as possible. If you'd like to sign your question, please turn your camera on during the Q&A session, and we'll be happy to facilitate this. Please do ensure that your username reflects the name you signed up to the webinar with. You can amend your name by clicking on the 3 dots over your image. We can't send you post-event information if we can't identify you as having attended the webinar. If you are applying for CPD accreditation, please be sure to fill out the feedback form that we will share in the chat. And then if you need tech support, please message Steph or pop your message into the chat and we will help. So I would like to start today with a message from Gurkhatin, the Indonesian Deaf Association. Gurkhatin is the national representative body for deaf and hard of hearing people in Indonesia, and it is a member of the World Federation of the Deaf. Gurkhatin and Deaf Child Worldwide are partnering together in Indonesia to support community mobilization, rights-based advocacy, and inclusion, including promotion of Indonesian Sign Language, which is called Basindo. So Ibu Wilma Rejeki, head of Gurkhatin and a deaf sign language user, asked us to share a message about the importance of deaf role models and deaf advocates to the welfare of deaf children, saying, "We advocate for equality between hearing and deaf people. We want deaf children to have equal access to schooling, and we provide extra support for them to enhance their literacy skills. But we also teach them about deaf leadership and the importance of deaf pride." So with that message, I'm happy to introduce our first speaker, Catherine Wachira, a parent leader with the group Lugha Ishara, which is based in Kenya. Catherine leads a parent empowerment program for parents whose children have recently been implanted and are using auditory verbal therapy. She is the mother of a son with severe to profound hearing loss. And so with that, Catherine, over to you.
Fantastic. Thank you so much, Liz, and for the organizers of this webinar. I hope you can all hear me. Yeah, there we go. As Liz so pleasantly introduced me, I'm Catherine Wachira. I am a parent leader at Lugha Ishara. And I'm happy to be here, and I'm ready and eager to learn from everyone else. So we'll just kick right off. So that's me, and I'll ask for the next slide, please. Here I'm introducing Lugha Ishara, who we are. Our mission is to end language development delays in deaf children and to enable their full participation in meaningful participation in all spheres of life. And our vision is a world where deaf children fully thrive in all spheres. Our core values, and I highlight them there because one of the core values that I want to talk about the most is trust. So we have our core values include inclusion, obviously being in the deaf space, excellence, showing up fully, boldly, with generosity, child-centered, because that's who we are talking about. That's our target audience, if I may call them that way. And of course, trust. And I'll be talking more about trust and navigating the medical system in Kenya and how trust comes into play. Next slide, please. Can you hear me? Next slide, please. Oh, there we go. I have already been introduced by Liz. What I do, she said I'm leading a parent empowerment program for children who are using auditory verbal therapy and were recently implanted. And that right there is Amari. You can see he looks like a deaf boy who is thriving, and that's what Lugha Ishara does. That you're not just surviving, raising a deaf child, you're also thriving while doing it. And if should you ever meet him in the streets of deaf inclusion, please call him Mr. AK. That's how he prefers to be called. And for me, it's an interesting experience leading this auditory verbal parent empowerment program, because it's my second journey, or it's the second time I'm going through this, because he just got his second cochlear implant with his parents in January of 2026. And so those parents who are getting their first one, their first cochlear implant, I see so much of myself in them. And sometimes I get so emotional just looking at it's like I'm looking back in time and just seeing where I was. Yeah, so it's a new reminding myself, relearning the things I'd forgotten about ABT and speech development and how all of that goes. Yeah, next slide, please. I'd like to acknowledge that the views I represent here are not solely based on my own experience. I carry the voices of other parents in Lugha Ishara who are not able to be here. Like I said, I am seeing a lot of myself when I look at the parents with whom we are doing the program with. So we are going through the motions together. Some of them I find triggering. Others I'm like, I can't believe I went through that and I came out the other side. And also it also strengthens them. I want to say, to boldly claim that it strengthens them, that they can see it can be done, that you'll come out on the other side whole. Yeah. So we'll dive right in. And I wanted to start by painting a picture of the Kenyan parent dilemma. Currently, if we take intervening on hearing loss as on the medical, we have the social elements, and then we have the medical, and then we cultural and all of that. But if we look at the medical element alone on how to deal with hearing loss in Kenya, it presents two options that seem mutually exclusive to the parent. So they either go the cochlear implant way, or hearing aids, or the sign language. And here I want to, the thing with cochlear implants, as we may all know, is that they give you access to the phonetic language. That's what it gives you access to. And that's true in Kenya as well, because our education system, our economic system is all about voicing. It's set and designed for hearing people. And that's what cochlear implants give children with hearing loss. However, the main disclaimer here is that relies heavily on early diagnosis and flawless tech maintenance. And we all know, as for all tech, there's no tech that will be flawless in its maintenance, much less that is being used by a child. Again, early diagnosis. For you to be successfully a successful cochlear implant user, you have to have been diagnosed early. Yet we don't have universal healthcare, and we do not have newborn screening. So already you can see a parent who is taking that direction must have really had their game together. Otherwise, you're already on a back foot. And then we have sign languages. Sign languages, of course, we know with the deaf experience, the deaf children integrate into it seamlessly. They get the identity, they get the conceptual development and that cultural belonging. But then now the child is yes, they face a lot of systemic and structural barriers to entry into the workforce, into higher education. So that's the Kenyan parent dilemma. And these two options are presented as mutually exclusive, where you can either do cochlear implants or sign languages when there's no empirical evidence that shows that sign languages interfere with cochlear implants, yet that is what the Kenyan parent is sold. Next slide, please. So here we are on the role of parent groups in navigating medical systems in Kenya. And one of the greatest roles that parent groups do is accepting diagnosis helping the parent accept the diagnosis of a deaf child. In most cases, as it is in Kenya and other places around the world, most deaf children are born to hearing parents. Therefore, the parent is most probably meeting a deaf child or a disabled person for the first time. And of course, that creates it's traumatic, it's shocking. Parents don't know what to do. And parent groups affirm the logic of a second and third opinion, because can you imagine? Sorry about that. Can you imagine the idea of you do not have universal healthcare, so you're paying out of pocket and you pay again and again and again, seeking a second and a third opinion because this diagnosis comes as a shock to you. So parent groups do come in to offer some affirmation that you're not crazy. I too sought a second opinion. I too sought a third opinion. And we'll see how that interplays later as a parent navigates the diagnosis. Then we do have fragmented and complex information. I'm not sure how many of you have seen a manual for the sound processor of cochlear implants. It's, I think, maybe 50 pages of information on maintenance and what to do and how to handle it, how to charge the battery, how to change the battery. A lot of information, and it's presented, and that's just the manual. So you have to go for mapping, you have to go for so many appointments, and in all these appointments you're being given technical and scientific information. And what parent groups do is they break it down into bite-sized information that a parent can understand. A lot of parents are also not that fluent in the technical English that is spoken at hospital level by audiologists, and so in a parent group, you'll probably find somebody from your tribe who speaks your language, and they can break down that information in your local language, and it makes that a bit more, it feels homely, it feels welcoming, it feels not so strange. They bring it closer to home. Like I said, we do not have a cochlear center in Kenya, and therefore our sound processors go to Dubai, I want to say, or India for repair. And that takes anywhere for between 3 to 6 months. So in the meantime, a child will either remain silent again, they have gone to no audio stimulation, and to avoid all of that, because many parents have really struggled to get that cochlear implant. To avoid all of that, many parents do come together and borrow accessories and processors in the meantime, as they send their sound processors to be for repair, or as they wait for accessories to be shipped in. Then parent groups also play the role of demystifying myths. Personally, I was told that I need to wait because I'm a first-time mom. I I have jitters, it could wait. Boys develop slowly, slower than girls. So just wait, give him time. And what parent groups do is that they again affirm the parent that you go ahead and just get your child checked, because the worst that could happen is that nothing is wrong. And if nothing is wrong, then you can sit back, sit pretty, and wait for your child to talk. But if something is wrong, then you do need to get the intervention, the early intervention that we spoke about. And parents do give that jolt or that push to that parent who is a bit hesitant because the doctor said, just wait. Or when they went for a well baby clinic, they were told to just wait. I went for all my well baby clinics and nobody caught it. They just said, boys take longer to talk. My mom told me boys take longer to talk, but deep down, I knew, deep down, my maternal instinct told me at 4 months that something is wrong with my child, but I just didn't have the backup I needed. So parent groups offer that backup. Yeah, next slide, please. Parent groups also offer, play the role of make believe, I want to say, where they show a parent that indeed what you're seeing or what you've heard online, what you've read about, what the doctors have told you, that can come to be. A parent is quoted as saying, and I quote, hearing of the success of children online sometimes feels like just another social media story. But when I come here and I see Amari running around, then I believe. Then it becomes real. End quote. That's what they said. Because when it comes to social media, I mean, social media is rife with information and stories about everything. So you're not sure, is this just another story, or am I, or will my child ever talk? Will my child ever call me mom? Many times parents want to hear, will ask me, did he even have the word mom? Was he calling you mom? Was he saying daddy? And when I say no, he wasn't, and then they see us having a fully fledged conversation, then for them it becomes real. Parent groups also play the role of diffusing the expert bias in parents. Parents enter the medical system with utmost faith in doctors. However, unfortunately, in our country, we've had instances where parents have been scammed. I had an audiologist once in the various early stages of my diagnosis journey. An audiologist sold me a hearing aid, knowing very well it will not be helpful for the level of hearing loss my child had. And today she's still practicing. And she's still practicing. I still hear people going from her. Of course, I dissuade them, but she's still practicing. We've had doctors who have rushed parents into decisions. They'll ask you, a cochlear implant now becomes a thing of urgency, of do it now, you have to do it, you have to get it right now. And it's simply because they stand to make a buck or two. And when even the parent has not processed the decision, then we have, on the flip side, when a doctor is profiling you and based on what they think is your social class, they will keep the information and not tell you. They'll not tell you that cochlear implants even exist. So parent groups, once a parent goes through that bias, then parent groups come in to diffuse that bias, and you affirm the parent and tell them that the doctor knows about cochlear implants, knows about the ear, nose, and throat physiology, but your child, you need to talk to different people and get different opinions so that you make the best decision for your child. And the result of that, when parents enter a medical system with utmost faith and get disappointed, the result is distrust. Now, mistrust, when you say mistrust, is just a general gut feeling. Like you could mistrust a situation that just from your gut, from your instinct. But distrust is as a result of a certain experience. So parents who experience that, where experts mislead them or provide them with information that is incorrect, inconsistent, or inaccurate, they develop distrust. And the remedy is when parent groups offer tried and tested referrals that they have already gone through and experienced. That way, a parent makes a parent makes an informed decision. Then the last thing I want to talk about as the role of parent groups is the skewed bias. Of course, the future I'd like to see, or the ideal future, is that we'll want to see a future where parent groups, where the voice of parent groups is heard. Because currently, experts or stakeholders will enter the Kenyan hearing health ecosystem with a bias towards their Kenya Connect or their local politician or whichever organization that brought them into the country. And that's where the funds or the resources get directed, even though it's not necessarily where the help is needed. And that means from the get-go, the program or the foundation of whatever it is the stakeholders will be building disparages the parent voice from the get-go. And so these are just some of the roles that our parent groups, I've come to see that parent groups have played for a parent whose child has just been diagnosed, and also from my own experience. Next slide, please. And lastly, I'd like to leave you with a photo of us. This is back in February, just after we concluded our workshop, our 2-day workshop with parents whose children have recently been implanted. That was in January 2026. This photo was taken in February of this year, earlier this year. And I'd like to leave you with a quote from Margaret Mead, and it says, "Never doubt that a small group of thoughtful, committed citizens, we can change citizens to parents here and say, committed parents can change the world. Indeed, it's the only thing that ever has." Thank you so much. That brings me to the end of my presentation. Thank you for your time. And I look forward to your feedback and questions.
Thank you, Catherine. Really appreciate that. I'm pleased to next introduce Ella Carroll, who is a community connector at the National Deaf Children's Society based in the UK. Ella has a personal understanding of the deaf community through her eldest son, who is profoundly deaf and wears bilateral cochlear implants. Ella holds a level 3 qualification in British Sign Language and has dedicated her career to supporting children and families. So thank you, Ella.
Thank you, Liz. Thank you. I have the first slide, please, Steph. Thank you. Thank you. So as Liz said, I have a background in early years in education, particularly with a passion of working with children with additional needs. Working closely with families has always been at the heart of my role. As a community connector, I particularly enjoy being able to support not only families of deaf children, but the professionals and external agencies who work alongside them. I'm passionate about helping families access the support, information, and the connections they need to thrive. I use my personal and my lived experience alongside my professional expertise to form the best support possible for each family in whichever way they need. Next slide, please. Our connector role is firmly rooted in the FCEI principles, ensuring that we build strong foundations with families through early intervention following their identification. We focus on connecting with families as early as possible, providing timely support and building meaningful partnerships, not only with parents and carers, but also with the professionals working alongside them. As connectors, our work is community-led and is tailored to the unique needs of each local area. This is what makes our role so distinctive. By listening to parents and valuing their experiences, we recognise that every community is different with varying challenges, resources and opportunities. We work collaboratively with families, professionals and partner organisations to co-produce solutions that reflect those local needs. Nationally, we are a powerful network of professionals with lived experience, supporting other parents of deaf children through our lived experience. We provide informed choice, emotional support and empowerment, helping families to make the decisions that are right for their deaf child. Our focus extends beyond immediate support. We are committed to creating sustainable systems and pathways that ensure deaf children and their family have access to the support they need from the very beginning. By doing so, we help future-proof communities and improve the outcomes for generations of families to come. The connections we facilitate have a lasting impact. Families gain access to a network of people who genuinely understand their experiences, helping to reduce feelings of isolation, uncertainty, and the emotional burden. Through these relationships, parents are introduced to services, resources, and opportunities that they may not have otherwise discovered. In short, the community tells us what it needs and we respond. We connect people, bridge gaps, and work alongside families and professionals to co-produce initiatives that create new opportunities and stronger, more inclusive communities for deaf children and their families. Next slide, please. The role of a community connector is to meet families where they're at, meaning not all will need or want support, but when they do, and if they do, we will be available to signpost them for questions and support. It's providing them with information that they need that is useful, or just being there to listen to their journey. My aim is to be an expert in my local area of what is happening for deaf children, what activities they could access, how to meet their peers, what services they can access, and if they need advice. We're not here to replace any existing services, but to simply act as a bridge to signposting families to the right people at the right time. Ultimately, to be a team of support around the family. Next slide, please. I wanted to share this quote from a parent who recently met one of our connectors at the Deaf Expo event. I think it shows the impact of our work, however brief the interaction may be, and how, as a parent of a deaf child ourselves, we can empower other parents to have the confidence and belief that they can make the best choices for their deaf children. Our lived experience is a key factor in our role, and being able to simply understand the emotional load, questions, and then support these individually is something quite unique. I'll leave it on screen just so you can have a quick read. Thank you. Next slide, Steph. Thank you. This list shows just a few examples of what support might look like from a community connector. Our role is flexible and adaptive to the families that we are working with. We use lived experience to empathise and support. We signpost to local groups and organisations. We can do internal referrals to our expertise internally to support with schools, advice and guidance. We can connect families to one another. We work with professionals to bridge gaps in their support. And most importantly, we listen to their fears, anxieties and worries. Thank you. Next slide. Working with professionals alongside the families means that we're ultimately providing a team around the family, viewing parents and professionals as equal partners to support the child's journey and providing informed choices to parents. The connections we have already made with professionals, such as teachers of the deaf, audiologists, and the newborn screening system alone, has been incredible and has meant that early intervention is happening more frequently with these key contacts making referrals to our services in a timely manner. As connectors, we're joining our local groups and our children's hearing services working groups, building relationships with parents, professionals, and networking to provide consistent support for families. Deaf-led groups have a huge impact for families. Meeting deaf role models, sharing their lived experience provides comfort, reassurance, and safety for these parents during a time where they're feeling isolated and vulnerable in their journey as a parent to a deaf child. Health visitors, nurseries, and schools are reaching out for resources from us on how to better their knowledge and understanding when supporting families with deaf children, utilising our internal expertise for their professional development too. Teachers of the deaf are making referrals for vulnerable families who need a little bit of extra support. Families are reaching out and wanting to meet other deaf families. When we discover a barrier, a struggle, or something simply not yet available, we use our network of professionals and contacts and co-produce a solution, reducing barriers and enabling more access for families. Working together with professionals and families, community connectors are doing just that, connecting deaf children and their families to one another and bridging the gap one step at a time. Next slide, please. The ripple effect focuses on the wider impact our role has within the community. I'd like to share a couple of examples from connectors in the South East. So our first one is at the Oxford Deaf Festival, a connection was made with a family in the area who was seeking local support for their deaf child. The connector was able to connect the family with a local support group and provide guidance to their daughter's preschool on supporting her communication needs through the use of simple British Sign Language. The ripple effect on that was a chance connection at the community event led to a family accessing both peer support and practical guidance. It also increased the preschool's understanding of deafness and inclusive communication, creating a more supportive environment for the child and potentially benefiting future deaf children attending the setting. The second example, one of our connectors made a presentation to health visitors and school nurses. Following that, health visitors referred the connector's first family with a newborn baby. The connector supported the family, signposted to local baby groups. The little one is now 18 months old, thriving, and mum came along to the local deaf charity group committee meeting to look at how she can then support local events going forward. Next slide, please. I'll let you have a read of this. This is just a visual of the ripple effect of the work that we do from one event and how that can impact the wider community. By supporting families today, we create a ripple effect that delivers lasting benefits for the wider deaf community and co-produces positive, future-focused change for generations to come. As we all share the same passion around deaf children and their families, I'd like to leave you with this quote today. Our vision is a world where anything is possible for deaf children. Thank you all very much for your time. I look forward to your questions.
Thank you, Ella. Again, you can put questions in the chat or you can save them for our Q&A session at the end. Our last speaker is Anne Porter, who is the co-chair and a founding member of GPOD, which is the Global Coalition of Parents of Children who are deaf or hard of hearing. She's also the CEO of Aussie Deaf Kids. Anne's youngest daughter was diagnosed with a profound unilateral hearing loss when she was 4 and lost the hearing in her other ear when she was 7. Since the diagnosis in 1996, Anne has supported parents and advocated on behalf of their families. And Anne is also joining us from Australia, where I think it is 1 in the morning, if not later now. So we have extra appreciation for Anne joining us, and we're ready for you.
Thanks so much, Liz, and thanks for the opportunity to speak today. My internet connection has been a bit dodgy, so I hope I can get through this. So in this presentation, I am wearing my GPOD hat as I wanted to briefly discuss a study undertaken by GPOD that provides some important insights that are directly relevant to today's topic. Since 2008, GPOD has worked to strengthen the parent voice through collaboration, advocacy, and leadership. We now have 16 parent-led member organizations, as well as individual members from countries where parent-led organizations are not yet really established. So we contribute to the World Hearing Forum, to FCEI International and KICA, and I'm currently represent GPOD on a CGHH committee examining early childhood hearing screening. So today I just want to briefly share some findings from GPOD-led paper published earlier this year in Deafness and Education International. Can I have the next slide, please? So the study began with the experiences of GPOD members. So many of them describe being invited to contribute, but still feeling kept at the edges, asked for their views without having real influence over decisions or outcomes. And this experience of tokenism often also reflected in the literature. Parents are still more often treated as participants or subjects of research than as partners who help shape questions, methods, and outcomes. So although there's increasing emphasis on involving parents in research as well as policy and practice in many countries, This has not always translated into meaningful involvement in the field of childhood deafness. So GPOD therefore we co-produced and co-authored a study that not only examined meaningful parent involvement, but also aimed to model it through the research process. Next slide, please. Briefly, I just want to acknowledge everyone who contributed to this work. Thank you so much. Next slide, please. The study addressed three important gaps. First, we know too little about how parents themselves experience involvement and what meaningful involvement looks like from their perspective. Second, we know too little about how knowledge grounded in lived experience is understood and valued, and sometimes limited within research and practice. And third, parents are usually discussed as people invited into processes designed by others. Far less attention is given to parents as initiators, so parents who can set agendas, commission research, and lead change. Next slide, please. So at the 2024 FCEI conference, so that's the Family Centered Early Intervention for Children who are deaf or hard of hearing. It's held in Austria every 2 years. All attending parents of children who are deaf or hard of hearing were invited to a GPOD pre-conference workshop. Participation in the workshop didn't depend on agreeing to take part in this study. So we used a participatory approach with parents involved throughout the study. So I'm not going to go into all of this. I'm going to give you a link to the paper afterwards. But today I just want to focus on three of the findings. So the nature of parent knowledge, the power of parent collective, and the pathway from self-advocacy to wider influence. Next slide, please. So one of the strongest findings was that parent knowledge cannot be placed into neat, separate categories. We began with a framework describing different kinds of knowledge, but parents' examples often overlap these categories. They stretch them and sometimes challenge them altogether. So rather than forcing the data to fit the framework, the analysis followed the meanings parents gave to their own knowledge. And what emerged was a picture of parent knowledge as layered and overlapping, evolving. It is shaped by lived experience, relationships, and over time. And this matters because recognizing parent knowledge as expertise requires more than simply listening to an individual story. It also requires us to understand how that knowledge develops, becomes more critically informed, and gains the capacity to influence wider policy and practice. Next slide, please. This is why the parent collective becomes so important. So parent knowledge doesn't develop in isolation. It grows through parent-to-parent interaction as experiences are shared, recognized, questioned, and reinterpreted in relation to the experience of others. We saw a movement from individual advocacy towards collective advocacy, so parents can develop the confidence and critical awareness to step beyond their own family's experience and act for the benefit of others. But this journey isn't automatic. It depends on relationships, resources, and opportunities that enable parents to connect, to reflect together, and to develop leadership. So this leaves an important question for researchers, practitioners, services, and systems. What conditions must we create so that many more parents can make this journey? So we used the 4C framework to explore different levels of involvement, and parents reflected on their experience across these levels. So much of the literature considers parent involvement in terms of how families engage with services to improve outcomes for their own child. Our findings suggested that self-advocacy is often the foundation of wider involvement. Parents first learn to advocate for their own child and family, and may then use that knowledge and confidence to contribute to the broader change in services, in research, and in policy. Next slide, please. So what does this mean in practice? It means moving beyond consultation. It means recognizing parent knowledge as genuine expertise. And it means deliberately creating the conditions in which meaningful involvement can occur. GPOD wanted the research process to reflect these principles, so parents didn't simply participate, they commissioned the study, co-designed and co-facilitated the workshop, contributed to the analysis, they co-authored the paper and provided the sign-off final for the paper. So the central message is that meaningful involvement doesn't happen simply because parents are invited into the room. It requires time, trusting relationships, accessible and thoughtful processes, respect for different forms of knowledge, and a genuine sharing of power from the beginning. So when those conditions are present, parents are not only consulted, so they become partners, leaders, and agents of change. Next slide, please. This is the QR code for the paper. And thanks to the support of the University of Manchester, it's available open access, so you can all read it in full. Thank you very much.
Thank you, Anne, and thanks to all of our wonderful speakers. So we will now open the floor to audience questions. So if you would like to ask a question or sign a question, please turn on your camera and raise your hand. And please say or sign your name before you speak. So thank you. If anyone would like to ask a question, if we're feeling shy, I can pitch the first one to our panelists. So I would be interested to hear from any of all of our speakers. I would love to hear your reflections on your fellow speakers' presentations. I would love to hear what you feel are the similarities between your experiences and perhaps the differences between your experiences. So if any of our panelists would like to field that while folks think of other questions.
I'll go first while I actually have a cogent thought. I was really, when I listened to Ella and Catherine, I just thought that what they were saying completely reinforced what I was going to say, the things that we learned through this workshop and through the work that we did about parent participation, and then moving from that individual advocacy further on. So you can see that both of these parents are moving along the pathway to, and that's what we really want. We want lots of parent leaders around the world so that they can be involved in things like research, in policy development, in program development. So it was really gratifying to hear their stories.
Thank you. Ella?
Thank you. I'd just like to comment off the back of what Anne said, and I just think listening to the both of them, it just aligns with everything that we were all sharing, that building that trust with families, building that trust with parents, taking that time. It isn't something that will happen overnight. It's about taking that time, our lived experience as parents of deaf children, and being able to support at whatever point in their journey they're at, to move forward and as you say, Anne, create those parent leaders that are going to advocate for these children, and our role as well to be able to future-proof the communities going forward for these families.
Thank you. Catherine?
Thank you, Liz, and well done to Ella and that those were wonderful presentations. And I'll just like to highlight the underlying theme of community and confidence that, or empowerment that parents get just from being in a certain community. It seems to be one of a key DNA in parent advocacy.
Thank you. And then do we have any audience questions? I don't see any in the chat, but if you would like to turn your camera on. Oh, Nancy.
Yeah, hi everybody. Thank you, Anne and Ella. Sorry, I'll not have my camera on now. I'm not able to have it on here. So I work closely with Catherine at Lugha Ishara, and I'm so proud of her as a parent leader. And I'm really moved by Miss Anne's presentation. It's interesting that you did a study on that. And one of the, or let me say this, our secret sauce at Lugha Ishara is that we actually started Lugha Ishara at the level of co-designing the solutions with parents. So I'm not deaf and I'm not a parent with a deaf child. So I really didn't have a solution. Let's do this. So from the beginning, that's where we started. So I wondered whether there would be an opportunity to work alongside you and probably other partners. To study Lugha Ishara in the way the model is, then reflecting back on the study that you did, sort of like a comparative study, because I feel like that's what we have cracked, and we have many parent leaders, and Lugha Ishara truly is. We have co-designed all the solutions from the beginning, from the last 8 years with the parents. So a question to you, Miss Anne, and I know, Liz, we have another discussion about the same, but we're looking at synthesizing our model, and we are calling it a change-making model, that when parents own co-design, then that's real sustainable change, including their children. That's the other element in our model. That's parents co-design, but then we also work alongside the children themselves. I don't know whether that's clear. Yeah.
Yeah, look,
Please
it sounds.
Yeah.
Yeah, so I did meet Catherine in Bad Ischl in Austria, so I know a little bit about your work. Look, we'd love to assist you in any way I guess we can. My mind's gone blank. I forget what I was going to say. But I think it works when you co-design with parents, it works for everybody. And I think that builds, you need confident parents to raise successful deaf children. And so I think always co-designing, building parent leadership is enormous benefit to the children as well as to the parents themselves. But yeah, look, if you are interested in talking to us, we'd be happy to assist you in any way we can with your program. You could join GPOD.
Yeah, thank you, Miss Anne. Yeah, I think we did. I don't know. We submitted an application. Maybe Catherine will confirm. Yeah, but happy to take the conversation further with you. Yeah.
Yep, sure,
later.
absolutely.
Yeah.
Yeah.
And thank you so much for being up late for us.
I'm up late, but not thinking all that well, I think.
Thank you. Do we have another audience question? Is there anyone else that would like to ask a question or give a comment? I'm not seeing hands raised in the chat. Okay, perhaps I can just pitch one more question if that's okay with our panelists. So either globally or within your own context, I would love to hear what you hope will be different in 5 to 10 years' time for deaf children and their families. And I see you on screen, so maybe I'll start.
Sorry, I didn't turn off my camera. So really, GPOD was sort of built on the premise, because how we started it was that we were at the Newborn Hearing Screening Conference in Como. This was in 2008, and we just heard presentation after presentation about how they were starting newborn hearing screening in different countries, what equipment they were using, and everything. And a few of us parents who were at the conference, we met under the tree and we said, we have got to do something about this. There hasn't been one mention of parents in this whole thing. So the thing that newborn hearing screening is going to do is change these families' lives, and yet nobody is talking about how they have engaged with families to make sure that the program is going to work and meet the needs of families as well as the program. And so that's how we GPOD really started. So and increasingly we are wanting to be involved in research and in program development. So what we do at GPOD is when we try and really encourage people to and organizations to start with parents. If you're doing research about parents, you need a parent on the panel to start working with them and co-design with parents, because the research is always going to be better. The program is going to be better if it works for families from the outset. So that's what I would like. I would like to see every time a new program or a new piece of research is being done about families, that there's a parent at the table from the outset.
Thank you. Catherine?
For me, I'll just hope that it's easier for parents who come after me. And a few years ago, I was involved in a mentorship. It was an education mentorship, a 6-month fellowship, sorry, not mentorship, a 6-month fellowship. And we were trying to reimagine education in our Kenyan context. And so my question was how we can ensure that deaf children are at par with their peers. And we did this using a design thinking framework. And my conclusion, using iteration, we ideated and all of that, the whole design thinking framework, I forget how it goes at the moment. But my conclusion was that early intervention was the key to ensuring that a deaf child can be successful at or academically successful or even socially in all the spheres of their life. And so for me, my goal is that, or my hope in the future is that in Kenya, in the next 5 to 7 years, we at least have a newborn screening and early EH, is it called an EDI program, early hearing detection and intervention program that is end-to-end, one that carries the parents or the family from the beginning, from the point where they're asking, they're curious, where is my child talking, to the point where they make informed choices about their child's communication future. So that's the end. And I hope that by the time we do that, then the conversation of having parents in the discussion has already been entrenched into the psyche of the stakeholders. Because I read even in the World Health Organization report, 2021 report on hearing health, that the role of the parent is very critical in designing programs. And I hope by then it's a normalcy and not something that we are pushing and pushing and pushing. Yeah, so that's the future I hope to see.
Thank you, Catherine. Ella, did you have any comment on that?
Yeah, I would just like to echo off the back of what Catherine and Anne have both said, that ultimately having that early intervention from identification, supporting those families and being able to offer informed choice from such an early stage is critical. I think building those parent leaders, building those advocacy skills, and ensuring that all of these children and their families have the support right from the very beginning at whatever point their journey starts and at whatever time is ultimately key. And us as professionals, as parents, as leaders, as advocates, that's something that we are all behind and enforcing. So yeah, I look forward to being part of the 5 to 10 year plan that we hope for these deaf children and families.
Thank you. And I see Helen has her hand up to ask a question.
Yes, thank you. Good evening, ladies. So I just want to ask a question that's like a comment. I like the research presented by Ms. Anne. And my question is, like, what are the kind of opportunities or what strategies are available to an organization like Lugha Ishara and the parents to advocate the same to government so that their voice is heard and incorporated. There are many policies related to facilitating disabilities, but specifically to the needs of deaf and hard of hearing children. I think for our context in Kenya, there's still a lot to be done. So I'd just like to hear, like, your experience. What are the opportunities? What are the kind of advocacy opportunities that we can explore?
Thank you. Catherine, did you want to field that one?
So that again?
So Helen was asking what kind of opportunities there are for parents in Kenya to advocate to the government to improve the lives of deaf children. Is there any opportunities in Kenya, maybe from your own experience, that parents have to advocate directly to the government?
At this point, the parent voice is still not highly rated, if I may say it that way. It's not one that is highly rated, especially because we are still coming from a context where parents were looked upon, like Anne said, as participants and not co-creators or collaborators of research. So the parent voice, I will not say is not recognized yet. We have a few pockets here and there. Yet for other disabilities like autism, we have very key parents. You know of key parents in the country who are very outspoken about their autistic children, but for deaf children, I cannot speak to the reason why we are still not yet there, but we do have individual conversations. I have conversations with stakeholders in government that I meet with teachers, with teachers or in the fellowship that I did or with friends. So it's very much still at personal discussions at personal level. And we do hope to see that it moves to the next level as a country. And I think that would happen, if I'm being presumptuous, a little presumptuous on my end, is if, like I said, external stakeholders collaborated. And by external, I mean anyone outside of the deaf space, outside of the parent sphere or the parent space, the government is willing to hear us, or anybody that is working in that space, then they're willing to hear us. But at the moment, Kenya still looks at parents as receivers of information, aid, resources, and not really as co-creators. And that's what Lugha Ishara is trying to solve. You demystify that even I have an opinion as a parent of a deaf child, because we are coming from a context where parents were very much receivers and helpless and victims. Yeah, that's what I'll have to say on that.
Thank you.
Can I just say something to that? Yeah, so I think so I'm based in Australia, and look, it takes years really to get where you want to be. It's not something that happens quickly. So it's taken me many years to get to where we are now, wherever there's research or new policy or something, we will be consulted. So that's taken years. It doesn't just happen easily. But what's happened with GPOD, what we're trying to do is start at the top. So particularly with the World Hearing Forum, because we felt that if we could influence what the information they were providing, and always insist that there was something about parents and parents' expertise within those kinds of high-level documents that governments do receive. I mean, around the world, the governments look at the WHO documents. So that's why we've really tried to target the WHO. And although the World Hearing Forum doesn't really meet our needs entirely, because it really is sort of geared more towards prevention rather than for people who already have hearing loss, it's been a good place for us to start. And we feel now at that level, and the people involved in the World Hearing Forum, that they are much more aware of parents as experts, and including parents as experts in the programs that they do. But I think it does take time, unfortunately.
Thank you. So we are at close. I do want to highlight Dr. Elaine Gale put a few articles in the chat about deaf adult involvement in early intervention and how deaf-led groups can improve outcomes for deaf children as well. So I direct you to the chat to take a look at those as well. That is all the time we have today. I do want to deeply thank our wonderful speakers and then also our interpreters and our captioner as well. I do want to end with a quick call to action that if you are a member of the Coalition for Global Hearing Health, I do encourage you to join the Family and Community Empowerment Committee. And then if you have ideas for future webinars, I will put my email in the chat. And then please reach out with any feedback or idea for future webinars. So with that, I'm going to go ahead and call things to a close. And thank you so much for everyone's participation on the call and in the chat. And thank you very much.
Thank you.
Thank you.
Thank you.